Hello there. Hey, TikTok fam. How are you? How are you doing today? If you are running, working in, or even thinking about owning or starting a home care agency business, stop scrolling, stop scrolling. Congratulations on wanting to own a home care agency. Today, I am breaking down the real challenges that private home care agency owners are facing. More importantly, I am talking to you, giving you some strategies on how smart agencies are winning. Yet, despite them going through and facing these challenges, so let's get into it because trust me, you need to know this information. So if you are just coming in right now, I'll get into it because trust me, you need to know this information. So if you are just coming in right now, you can share this live to as many people as you can. Just, hold on to my nose right there, press it, and then go ahead and share, okay? All right. Happy Easter weekend. I hope everyone is doing good. I would have loved to do this during the weekday and perhaps in the morning. But we've been running around trying to prepare for Easter Sunday. So if you are just coming in, welcome. Thank you for joining. I'm going to talk about some of the challenges that we face in home care agencies. What challenges you will be facing if you are thinking about starting a home care agency, you have one already and you are new to it. If you're just coming in, please go ahead. Hi, Angie. Hi, Nanette. Go ahead and just tap the screen for me if you're just coming in. We're going to talk about these challenges, and we are also going to talk about what some smart agencies are doing to win despite those challenges. All right. So if you want to know what the number one reason that most private home care agency businesses fail in their first year, let's talk about it. All right. You're happy, you're thinking you want to start this business. Home care agency is a thriving business. A lot of people are doing well, but some people come in and then within their first year, they fail in business. Why is that? So one of the challenges in home care agency right now, especially after the pandemic, is caregiver shortage. When we're talking about caregiver shortage, depending on what your agency is offering, the kind of services, you might be providing nursing care along with non-medical care. So what we are talking about here is owning a private home care agency. So let's define that. A private home care agency is not a home health care agency. There are two distinct two distinct businesses. So a private home care agency provides services in the home to clients who need help with meeting activities of daily living. For example, you have an elderly parent who lives at home alone and you need someone to be able to care for them. Maybe they're not able to do their own things. Or perhaps you had surgery and you're being sent home from the hospital, you're coming home or your family member is coming home and you don't have the time or the ability because life continues. And you need someone to come in there to help with light housekeeping. You need someone to help give your loved one a bath. As you're coming in, please go ahead and tap that screen for me. Let me know that you are here. And if my information that I'm sharing is beneficial to you, go ahead and tap the screen too. Thank you so much for coming in. So that's the difference between a private home care and a home health. Home health agencies actually provide skilled nursing services. They will send you a physical therapist, occupational therapist, speech. A nurse will come out and do IV therapies at home, all of those things. So that particular business, it's a little harder to open because we're talking policies and the costs of opening that is a little too much for some people. But if your plan is to be in the healthcare business, be in a business that you feel good at night sleeping because you're helping people, but you don't want to spend so much money, then the private home care agency is the route to go. So I just wanted to clear that up. If you have a question, go ahead and put a question right there, down there at the bottom actually. And I'm new to this. I just, I have a lot of clients off of these off of TikTok, and one of them said, you can offer these services, you can help people online. And I thought, TikTok, that's the way to go. So this is like my third live, so a little bit of encouragement will be just fine. Hi, yo, good to see you. Hi, Trey. Good to see you. I think it's Trey Will, and I don't have a moderator today, so it's just me, myself, and I. All right, good to see you. I think it's Trey Will, and I don't have a moderator today, so it's just me, myself, and I. All right. Before you step into something, it's good to do a little background check. There is no business that is easy. A friend of mine called me the other day and said, can you tell me how I can get into the healthcare business and not have to work so much? And I thought to myself, I don't know one. If I did, I think I'd be doing it too. But I do know one that you can work in, make the money, feel good about yourself, because every good thing requires some work. Go ahead and tap the screen for me as you come in. As you come in, please tap the screen so I know that you're here. Thank you for joining me. And share. You can just press onto my nose right there, and it'll pop up to where you can share this to the people who can benefit from it. So let's say you are not thinking about opening a home care agency, or you don't own one, but you know of someone who can benefit. Then please, by all means, share this with them. I have owned a home health agency now for 10 years. Yes. So if you want to know, I'm charging my phone, so it's a little too much. Hello, everyone. Hi. Thank you for coming in. Hi, Hariamo. I think Laura. Hello. Thank you. So I have owned a home care agency for 10 years. I started in 2015. At the time, I was already working as a registered nurse at the hospital, and my background is in pediatric nursing. Hi, Harry Mo. Thank you. Thank you. Please tap the screen for me as well. Thank you for tapping. I appreciate you. And so in 2015, when I started, it was very difficult to get someone to help. In fact, I had to pay a consultant all my savings. Yes, I had saved money because I knew that I had something to offer. So I thank you for sharing. Thank you, Harry Mo. I am so grateful. So I asked a few people. I knew of one or two people who own the agencies, but nobody wanted to share information with me. So now my goal is to help as many people this year, not only to own an agency, but to achieve success. Because it's one thing to own it. Like I said in the beginning, a lot of people, close their doors the first year in business because they just did not have the strategy. So you need the strategy. You need to have a sound foundation, and you need to know how to navigate not only, the small challenges of caregivers or anything like that, but the policies, because it's heavily regulated. Thank you so much. Please, thank you for tapping. Thank you for sharing. I appreciate you so much. Thank you for the encouragement. Woohoo! Thank you, because this is my third live, I believe. I may not know the ins and outs of TikTok yet, but I do have information that can help you and save you some money. So let's talk about some of those challenges. If you already have a home care agency, you paid someone, they opened it for you, congratulations. It's a wonderful business. Now, how do you do it? Where do you go from here? Last week, I had a gentleman come to me, and he found me online. And he said, I found you online, and I spoke to a friend who knew you as well. And they said, I can come on here and get some information. Thank you, my love. Thank you so much. I appreciate it. So I asked him, what's the problem? He said, well, I've had this license since Thank you, Harimo. I am so grateful for that, Rose. Thank you, thank you, thank you so much. So I said, how can I help? He said, I've had this permit for two or 3 years, I think. Thank you. He got the permit in 2021 and had not a single client. That is a failing strategy. How do you go from having a permit to having a thriving home care agency? And what are the issues that you have to navigate and overcome? First thing, problem number one, caregiver shortages. A few of my people that I've opened a company for, they come back and they go, I can't hire. I can't find someone to do the work. What do I do? I'm not going to sugarcoat it for you. It is very hard to find and keep good caregivers. Many agencies struggle because caregivers leave for better pay or they just leave for better hours. So how do you navigate that? So some of the detailed information I will give to my subscribers. I have a few of my clients that I hold their hands and we kind of have a meeting weekly on how to go from point A to point B. So listen, I'm not new to this. I have been doing this for 10 years. Kind Touch Healthcare Services. Look me up. We have been in business for 10 years now. Thank you. Thank you so much. We have been in business now for 10 years. When I started, it was rough. There are still some challenges that we're all in it together. So what you get from me, it's real strategy. So hit the subscription button as well. Right there. And when you subscribe, there are benefits to that. I hold boot camps every so often through the year, and you can get good discounts to the boot camps. As a subscriber, you will get detailed information about how to move your home care agency forward. All right. So what do you do in order to get clients? So let's talk about that. One of the things you want to do, everybody wants money. Everybody wants to feel like, they go home with a good paycheck. So offer competitive pay. That's it. So check into all these other agencies. I tell my clients, don't just close your door. Don't just say, okay, I've got this agency. I'm here. I know you haven't made it yet because it takes at least 2 to 4 years to consider yourself a success in any business. It's not just home care agency. As you come in, please tap that screen for me so I know that you're here. And if you look up there by my name and you can check in with the heart, I will so much appreciate it. Okay. At the top right there, where you see Dr.B, go ahead and hit that heart. All right. Join my team. We have so much more information. Send this information to somebody else. Invite other people to the room because there is some good information to be had here. Okay. So what would you do to get, thank you so much. Thank you. I really appreciate you. Thank you. So offer some competitive pay and benefits, right? Even the smallest things like a gas card or a bonus for perfect attendance. Don't just think, I'm making the money. It's my business. It is not just your business. You need people to make a business successful. So if you have some good people, you want to take care of your caregivers. Your employees are an important part of your business. I tell people every day, your clients are not just the patients, not just the people you take care of. Your clients are also your employees. Let me say it the other way around. Your employees are also your clients. So as good as you take care of your outside clients, take care of your inside clients as well. They're family members. Thank you, Harimo. I am so grateful. Hi, Debbie. Thanks for joining. So take care of your team. Take care of your caregivers, and they will stay with you. Sometimes it's not really about the money, but it's about how valuable they feel. So that leads us to the next thing. It's hard to get them, and it's hard to keep them, right? Because there is a high turnover in this industry. Somebody is always going to somewhere else because there is a penny or because something else has been offered to them. So to find good caregivers, you want to offer flexible schedule, right? You build a positive work culture. I've heard people talk about, actually, we had an employee come in last week, well, she was a potential, now she's one of our team members. And during the interview, my HR coordinator asked the question about why she was leaving her previous agency to join us. And she said, well, I didn't feel appreciated. I did not feel appreciated. So appreciation goes a long way. You cannot just treat your people as if they're numbers. I tell people all the time, I am not the only one that owns Kind Touch. All my employees, all my team members are Kind Touch. They are a reflection of Kind Touch. They are a reflection of what we do. And so I cannot do this work without them. So that big challenge you can overcome the high turnover by treating your people well. So offer competitive pay and benefits, even small things like a gas card. Those are helpful. Build a positive work culture. Show appreciation. Someone did something good. Say they did it good. Maybe a client called in and said so-and-so was such a good caregiver. She did this and that today. High five, say thank you to them. Give them a gas card because, the price of gas is high and employees pay, buy gas to travel from one client to another. So give someone a gas card. That helps a lot. With high turnover, you don't want to just hire people and then in 2 weeks they leave, especially because you invest so much into hiring them. You invest to advertise your job. You invest to do a background check because in home care agency arena, you must do a background check. That's just policy. And it is important because you're sending people into somebody's home. If I'm receiving a caregiver, I want to make sure that this person is clean. I want to make sure that my loved one is safe in the home with whomever your agency is sending. So there is a need for background check. That is actually a policy. And it costs you to do so. All right. So you don't want to pay for all of these things, get them in, do the training, train them on your policies and how things work in your agencies. And then 2 weeks later, they're gone. So how do you overcome that? Invest in better onboarding training. Hello. Hi, Picasso. Hi. Thank you for stopping by. Please tap the screen for me when you come in. Let me know that you are here. And if this information is helpful to you, tap the screen. Click up there by the heart. You'll see by my name, Dr.B, you will see a heart. Go ahead and tap in. And that just tells me that you're here. Okay. And welcome into the room. If you do not own a home care agency, you do not plan on owning one, but you know someone who can benefit from this, go ahead, press that screen, hold it. It'll give you opportunity to share with as many people as possible. All right. Very good. Thank you. Thank you. Go ahead and press the screen for me. Thank you. So invest in better onboarding and training experience. Don't just hire people. I've heard about agencies that hire people virtually. You never get to see your person that you just hired and you send them along to a client's home. If I were the clients, I will be so eerie of that because people can say anything to you over the phone. There is something about having a face-to-face contact and connection with the person that you're hiring to send into your client's home. Thank you so much for the follow. I appreciate it. Thank you so much. And so go ahead and make sure that you have good contact with the people. Have a good onboarding and training pathway. Don't just send them out. Because if you send someone, let's say, for example, it's a new caregiver, right? Whether it's a CNA who just finished school and they come to you looking for a job, or it's just a caregiver that you're training, because that's the other perk of the home care agency world. You can train them on your own. So let's say that's what it is. And you've trained them and you send them in and they know nothing. You are just showing the clients that you're not ready, that you don't care, that, the client is not important to you. So why should they trust you? So go ahead and create a career path. Example, have something for your employees to look forward to. Say, okay, I'm coming in as a caregiver today. Maybe tomorrow I'll be a senior caregiver. There's a little bit more pay and there's some perks to that. And then I'll become a team lead. So employees feel like they can grow with you. And people want to grow. People want to be a part of something good. They want to be able to experience, and feel like they're giving back to the community. So create a career path for your employees or your team members, right? So we've talked about one of the top reasons that people close their home care agency the very first year. And we've talked about which is caregiver shortage, not being able to find a caregiver. And we've also talked about the high turnover rate where you get them and they don't stay. We've talked about what you can do. You have to invest in a better onboarding experience for your people. Don't just send them out on their way and say, go take care, just go give a bath and come back. That doesn't work. Hi, Nancy. Hi, thank you for joining. So another thing is client retention and satisfaction. So you deal with the issue of not finding people to hire, and then you find people. And then there is the issue of the high turnover rate. And then you overcome that by how you treat your employees, by how you create a career path for them and how you take time, invest in your employees and they will stay. Make them feel valuable and they will stay. And your agency will grow. And then now we have to deal with client retention. Home care agency ownership is good, but the field is a little saturated, but not too saturated. There is competition in it. Clients have choices. That's what I mean. They can go anywhere. What makes you important? So if families or clients are not happy with you, if you're taking care of my mom and I come home and my mom says, this caregiver didn't even know how to give me a bath. They didn't even know how to make my meal. They didn't even know, and the complaint comes in. I'm unhappy now because I'm paying you to provide these services. First, it tells me that you do not train your employees well. Secondly, you are not just your agency is not good. I'm not happy. There are thousands other agencies I can go to. So how do you overcome those challenges? Number one, regular check-ins with clients and families. At least monthly, we do surveys with our clients. Every now and then, I have clinical managers, but I still go out and I visit with my families and I talk to them. I want to hear what's going on in their lives, and it is genuine. Don't just, when you fake it, people can tell. When you're just asking how are things, and they can tell. Hi, Peaceful Rose, thank you for stopping by. So you want to check in with your clients either on a bi-weekly or a monthly, basis call. You have a clinical nurse supervisor who goes there to supervise at least monthly. You make that call as well. And you want to know how they're doing. Check in with your clients, train your caregivers in customer service. I tell all my team members, you're not just an employee, you're a family member, you're a team member, and you are the face of Kind Touch. So everyone must know customer service. There are instances where our nurses will call us up. Hi, Comfort, I see you. There are instances when they will call us up and they say, oh, so-and-so is having this problem. Keep in mind, we do more pediatrics. We also take care of adults. But they'll call and say, somebody's having such and such situation, and I think we need to do this before we lose the client. That's good. That shows that your employees or your team member, they value their job with you. They want to stay because you also value them and they don't want to lose their clients. When you come into this room, please go ahead and tap the screen for me. I really appreciate you. Thank you for joining me. You could be anywhere else this evening, but you choose to come in here. So tap the screen. And should the information that I have going on not benefit you, there's someone in your team, someone that you know, go ahead and share it with them. If you would just press my nose right there, you will be able to share this with as many people as you can, okay? Thank you. Philip Anthony Mitchell. Thank you for joining. I appreciate you so much. So we've talked about the difficulty in hiring caregivers. So if you are a first year home care agency owner, you're just thinking, oh my God, how do I get employees? How do I get this to happen? How do I get someone to want to work for me? We've talked about that. So I'll recap. You want to offer competitive pay. So how do you know what is competitive? Look around. Check out what other agencies are offering. What are they paying people? Don't go paying anybody $10 an hour, because that is, in this economy where eggs is $10 an hour. I mean, $10 for what? I think 12 pieces, a dozen or half a dozen. You can't just pay your caregiver $10 an hour. That does not help. So good pay. Hi, Vivette. Thank you for joining. I appreciate you. Please tap the screen for me as you come in. So offer them a good pay and also build a positive work culture. That will help. All right. Show appreciation. It does not take much to appreciate someone. A gas card is very relevant in this time when gas is so expensive and home care calls for people to drive from one place to another. Okay. Listen to your team members. Listen to your employees. Listen to them. Don't just say, oh, I'm the boss, I own the business, so you don't want to hear what anybody else have to say. That's a good way to fail. That is not how you succeed in business or in life, in anything. So you have to listen to your caregivers because they have something to share. The way that I approach things with my staff, I tell them we're all in this together and I'm genuine about it, because whatever I do it thinking there are 35 people, 35 families that I'm helping to feed. And I will not do anything to jeopardize putting food on their table. So they know that I'm genuine about it and I want them to succeed. So when you show appreciation, when you show that genuine heart to your caregivers, they see that. People see when you're genuine. When you are not and you just talk, people can tell as well. So employees will stay if they see that you appreciate them. And you wouldn't have the high turnover rate. That's a big thing in this industry. In home care agency, there is a high turnover rate because there is another home care agency somewhere that they can go to. So for us, I've been doing this for 10 years. I've owned Kind Touch Healthcare Services for 10 years. You can look us up. And we focus primarily on pediatrics. We take care of children from 0 to 21 years of age, and then we transition them into our adult waivers. So now we do both adult and children. Hi, Danielle Stewart. Thank you for stopping by. Please tap the screen for me. As you come in, go ahead and tap that screen for me, please. Thank you. And if this information is valuable, tap the screen. You can also click at the bottom there. You can subscribe. Go ahead and subscribe if you want more than what we can do on TikTok, because there's a whole world outside of here. Hi, Comfort. I see you. And so the next thing that we want to do, or we want to talk about, the next challenge. So we've talked about difficulty in hiring caregivers. Hi, Zach. We've also talked about the problems with turnover rate. And the next thing I was about to touch on was client retention and satisfaction. You work so hard to get your first 5 clients. First 1, 2, 3, 4, 5. You don't want to lose them like that. So how do you keep your clients? As you come in, please just tap that screen for me. I appreciate you so much. Let me know if this information is valuable. I appreciate you so much. Let me know if this information is valuable. And leave a comment on the screen for me. Tell me, yes, it's working. Yay. And remember, this is only my 3rd live. So any encouragement is wonderful. I appreciate that so much. Thank you, Zach, for staying on. All right. So if families or clients are not happy, they will switch agencies so fast, faster than you can say ketchup. They'll be gone. So what do? Solution number 1, regular check-in. You cannot just say, oh, I've got this client and I'm sending my caregiver, and then you just forget about them. And then every 60 days or so, you send a nurse to go and do a supervisory visit. That does not help. Hi, Jack girl. Hello. Thank you for stopping by. Please tap the screen for me as you come in here. Tap the screen. I appreciate you. User 310. I can't say all the word, but thank you for stopping by. Just tap the screen, and up there, you by my name, you'll see a heart. Just check in. That's a good way to check in, to let me know that you are here. Thank you so much. So call your clients monthly. Make a calendar. Okay, create a calendar for yourself and say, okay, I have 2, 3, 5, 20 clients, and I'm going to check in on my clients and the family. And maybe a monthly call. It doesn't take much. Have a sit. Pull your phone out, pull the phone number, call your clients, ask them, how are you, Mrs. So-and-so? This is Blessing, the owner of the agency of Kind Touch Healthcare. I'm just, by now, they know you. I'm just checking in. How are things going? Do you like your caregiver? Check in with them. Be genuine. Listen to what they have to say. Send out a survey as well. But I think the best survey is a phone survey with your clients. You listen, they talk. And if they have some comment to give you, all criticism is not always bad. It may bite, but you take something out of it. So they tell you what they don't like or what they like. Hi, Tanisha Celeste. Thank you for stopping by. And then you learn from it. Secondly, you want to train your caregivers in customer service. It's not just enough that they know how to give a bath, right? It's not just enough that they know how to make a meal for their clients. It's not just enough that they know how to make the bed. Hi, Mac Williams 641. Thank you. Please tap the screen as you come in. Tap the screen for me and share this information with as many people as could benefit from it. Thank you. So train your caregivers in customer service, meaning let them know how to communicate. Communication is a big thing in the home care agency, as in any other business in life. If someone doesn't know how to communicate with you, there is a problem. If your caregiver doesn't know how to talk to the client, there's a problem. Remember, culture also plays a big part in caregiving. I tell my people all the time, when you go to someone's house, first of all, pay attention to the door. What do you see? A lot of the people that we have people from other cultures, and they don't wear shoes inside their houses. And I tell my caregivers, I tell my nurses, myself, when I go to visit people's home, I look, I pay attention. If I see that they put their shoes out there in front of the door before they step in, I'm going to take my shoes off. Many times I proceed to do that and they go, oh no, Dr. Blessing, you don't need to take your shoe off. Just come on in. I said, no, everybody else has their shoes off. I'll have mine off as well. That shows respect. That is a sign of customer service. That means you're paying attention to your clients, okay? And you teach your caregivers to do the same. Don't just teach them how to run a G-tube. Don't just tell them how to sweep the house. Don't just teach them the technique of transferring client from a bed to a chair, wheelchair, and so on and so forth. Teach them good customer service. Teach them how to communicate. Communication matters in home care, right? The third thing you can do to retain your clients and keep them satisfied with your service, personalized care plans. We talk about showing that you listen. When you listen, you are able to create a care plan. Hi, my daughter. Blessed. Thank you for coming. Today is Easter and I see you here. I'm so grateful. So you want to listen to your people. When you listen to them, you will be able to personalize their care plan, right? So if you are coming in to do an assessment, you come to my home, you're a new home care agency owner, you're excited, you got a referral for a client and you go to meet your client. You want to pay attention. And they tell you, okay, this is my problem. My mom is not able to walk from her bedroom to the bathroom. That's a problem you need to know how to solve. That is what you take back home or back to your office as you're creating a care plan. And the care plan needs to be a conversation between you and the clients. The clients will tell you what they want. I need someone to be able to accompany my mom or accompany me to the doctor's appointment. I need someone who can pick up my prescription every Thursday. I go to bingo every Friday and I want someone to be able to take me to it. I don't like salt, or my doctor says I shouldn't eat salt, so I like to have just a little bit of a dash or whatever that seasoning is in my food, and no salt. So see what you, thank you for the follow. I appreciate it. Thank you so much. Please tap the screen for me as well. Let me know that this message or this information is useful to you. And also, over there by my name, Dr. B, you'll see the heart. Go ahead and tap that heart sign. I can do the heart sign. Isn't that something? So, but go ahead and tap that for me, okay? And check in. Let me know that you are here. Thank you for coming in this room. This room is really about opening and running and succeeding in a home care agency business. A lot of people think it costs so much to open a private home care agency, and it doesn't. And then there are those who have opened one and then they shut it down the first year because of the challenges. What I'm doing is teach you how to get from point A to point B. I'm helping you to open. I said in my last live, this is only my third live. And I said, my goal this year is to help as many people, especially women, to become business owners, especially home care agency owners. I myself have owned one for 10 years now. I own a company called Kind Touch Healthcare Agency. And I also own a consultant business for people who want to open and run their own home care agencies too. And that's called Vision Growers. My job is to help you grow your vision, see your vision come to fruition. So please, as you come in, hi Essence Diamond. I'm charging this phone as I'm doing this live, so it's trying to sleep away. Go ahead and tap the screen for me as you come in, please. And then the heart up there, please click on that heart. Check in with me. Hi, Miss G Love. Thank you for joining. Thank you. And if you are not thinking about opening a home care agency, or you are not running one or thinking of running one, send this to somebody. You might be surprised. This is the kind of business that gives you joy. It has done that for me for 10 years. And you make money. You make money, but the cost of starting is very small compared to most other businesses, right? So before you start, or if you have one already, what I'm doing is give you information, very valuable information that you may have paid someone to get, but I'm giving it to you for free. Now, if you want a more in-depth dive into how do I go from point A to point B, go ahead and tap that. Subscribe to my page and subscribe. And I have some, real more intense and in-depth information for my subscribers. So I appreciate the subscription as well. So I was talking about one of the issues is how do you retain your clients, especially if you are new to the industry, to the business. How do you retain your clients so that they are not going on to the next person? And we talked about regular check-ins in any business, but especially in home care agency business. You've got to check in with your clients. Hi, JJ Rooster. Thank you for coming in. Please say hi when you come in and tap the screen. It doesn't take much. Just tap the screen for me. I appreciate that. So check in with your families. Also train your caregivers in customer service, not just healthcare. Don't just train them on how to become good providers of services. Train them also on how to be good customer service providers. They need to pay attention to their clients and have a personalized care plan. This is actually very important. A lady called our office on, I think it was Monday last week, and she said she wanted to switch agencies, and we get those calls so often. And so our office coordinator who takes the call asked her, why did she want to switch agencies? Why was she coming to us? And she said, well, the agency that I currently am with, they do not have a care plan for my daughter. I need a personalized care plan. I need to know what is going on day by day. And we were like, wow, we thought that was just what you're supposed to do. And that's what you're supposed to do. How can an agency not have a personalized care plan for their clients? So make sure that you pay attention. That first encounter that you have with your potential client, pay attention. Listen to them. Listen to their needs. Listen to what, if it is a child, a daughter, a son, family members calling because they need help for their elderly family member, pay attention to what their needs are. Then take that back with you and create a care plan that is personalized and is focused on that person. And once you create that care plan, that's what you train the caregiver to follow. The caregiver will then have something to do day in and day out. When they go into the home, they know this is the first thing we're going to do. This is the second thing. If something happens, if something doesn't go the way the day was planned, this is the next step. Oh, on Thursday, Mrs. B goes to bingo and I'm going to take her to bingo. On Fridays, she likes to eat rice, so we're preparing rice today. Those are some of the things, and her laundry needs to be done every Saturday. I'm going to be doing laundry, changing her bed sheets once a week. Those are the things that are personal to Miss B. You cannot just send a caregiver into the home for them to do what they did at Mrs. Thompson's house. They're going to do the same at Mrs. B's house. That's not how it works. That is not a personalized care plan. So make sure that there is a personalized care plan. Hi, thank you, Taj. Thank you for joining. As you join into this room, please tap the screen for me. I will so much appreciate that because it's an encouragement for me as well to continue to provide these services. My goal for this year, I feel that to whom much is given, much is expected. I have been given so much. Hi, Big Mike. Thank you for coming in. Please tap the screen for me. Tap the screen for me. It doesn't take much to do that. I've been so blessed. I've owned this agency, my home care agency, Kind Touch Healthcare Services, for 10 years. And so many people have come to me and they ask me, how did I do it? How did I get into it? And how am I succeeding in it? So I started a consulting business and I've helped so many people. And then one of my clients said to me, you can provide services online. You can do a TikTok because there are people who may not know me and don't have anyone to talk to, but they can get some valuable information here. Last week was my first live, and information, if you can just check on my page, you'll see some valuable information that I give. You can do some things by yourself and not pay someone, right? Until you get to the point where you need to pay someone when it comes to the compliance and the regulations issues, the policies, because you will need a policy in order to open and run a successful home care agency. You want to be compliant with the requirements of your state. Individual states have different rules and regulations that you must follow. But before you even get to that point, there are some things you can do on your own. And that was the information I gave last week. For instance, how to register your business. You go to your Secretary of State website. How to get an EIN. Some people don't know what that is. That's an employer identification number. And you need that because you're going to hire people to work for you, and they're going to need to file taxes. You're going to need to give them a W-2 and other things that you do in business. So I teach you how to get those things on your own. You don't have to pay someone for those. But when it comes to the compliance issues, when it comes to the rules and regulations, the policies, that's where we can help you, or you can go to someone else to help you. But I've done this business for 10 years. There is a difference with someone who is just a consultant and comes to you and say, I can help you get a home care agency. And they can very well put the paperwork together. But if they have not owned a home care agency now, tell me how they can help you succeed. They'll put the paperwork for you, because I've had quite a few people come to me and say, I went to someone else, and that's okay. And they opened my agency for me, but now I'm lost. And I love it when they come, because then I can share real solutions for them. So today, I am really just addressing some of the challenges in owning a home care agency. As you stop in by this room, please tap. It is an encouragement for me. If you would just tap the screen, if this information is useful to you. If it is not useful to you, please share it with someone. Press on that area by my nose and hold, and it'll give you an option to share with your friends, with people who can actually benefit. 10 years ago, when I started my agency, I had saved a lot of money that, for someone who didn't have a lot, that was a lot of money for me. I paid a consultant $20,000 to give me this information, and they helped me to a certain point, and then I just didn't feel like I got enough for my money, and I had to learn on my own. The first year in the business, we met negative 40,000. Don't ask me how. That's because I was working 2 other jobs supporting my business. And instead of making, I had lost in advertising, lost in, I got a set of clients I shouldn't have gotten that cost me so much money. And that's a story for another day. But my job now is to help as many people open it successfully, open it without spending so much money. To be honest with you, you can spend less than $10,000 to open a private home care agency. It's a business that is rewarding, right? Because many people, the population, the baby boomers are aging. Many people need help. And it's not just the elderly. There are people that are sick and are home, and they need someone to help them, help remind them to take their medicine, help them prepare their meals, help with light housekeeping, help with their laundry, anything, because maybe the wife is the only one working and the husband is the one sick at home. That's where you come in. So you bring your empathy, you bring your heart, and you make money out of it. And that's one of the things I tell people. Don't just want to be a business owner. Hi, Rinash, I hope I said your name right. Thank you for stopping by. Please tap the screen if this information is useful to you in any way. Just tap the screen, and you can also subscribe to get in-depth information and hand holding and step-by-step of how to go from point A to point B. Hi, Richard Whitten. Thank you for stopping by. Please tap the screen for me. I appreciate you for stopping by. So I tell people, when you want to own a business, you said, this is the year 2025, I'm going to do it. I'm going to be a home care agency owner. Now, don't just do it because you hate your boss. Don't just do it because you just think there's money to be made. And I think people can see when you are genuine. It should be, listen, that you have found a problem and you have a solution for it. If you're coming into the private home care agency arena, it's because you've got the heart. It's tough. There are challenges, which is what we're talking about today. But that heart of service, that heart of wanting to help people. In fact, the people you hire, your caregivers, your team members will sense it. They will feel it. And you attract people who feel like you. And that's one of the ways that you will avoid the high turnover rate. That's one of the ways that you will retain your people, because you are kind to them. You are kind to your clients. In fact, they both are your client. Your employees are your client. And your clients, the people you care for, the patients, they are your clients as well. So those are some of the things that you want to think about as you embark on owning a business. Because like I tell my clients, once you clock in, guess what? You're not clocking out again. You're not clocking out until you sell that business. If it was meant as an investment in that way, you hand it over to somebody. Those are some of the things we'll talk about. What you do with your business as you come in. Is it an investment? Is it a legacy? What is your plan for your business as you come in? Hi, Toot Fairy. Thank you for coming. Please tap the screen. And if you look up there at the heart by my name, go ahead and check in for me. I really will appreciate you so much. Thank you. Thank you, Slinda. Thank you, baby girl. Thank you for coming on here. All right. So the next thing that we want to talk about, we've talked about difficulty in hiring caregivers, and we've talked about some of the solutions. We've also talked about the high turnover rate, and we've talked about some solutions for that. And if you need in-depth and you need strategies and you need the templates and you need guidance, please go ahead and subscribe. Subscribe there. I think it's only $2.99 a month or so, and you will get in-depth direction, hand holding, support from me and my team. Now, the next thing that we want to talk about is compliance and regulations. In the home care industry, there is heavy regulation. Why, you want to know? Because it deals with human life. It's healthcare. Not only that, you are sending people into other people's home to provide services. So there need to be some rule. There is HIPAA regulations. There are things that needs to be done. There are paperwork, tons of paperwork, licenses, audits, especially when you start becoming a Medicaid provider. And that's something we'll talk about another day. That's another source of revenue for your home care agency business, is to become a home care or a Medicaid provider. Now, that's why there's a lot of paperwork. And every year you get a survey from the state. Whichever state that you own your business, they have surveyors from the department that oversees your permit. They come in and they survey you. Hi, Mel. Thank you for joining. Please, as you join, tap the screen for me. Just tap your screen. Just tap, tap, tap. I appreciate that. It'll let me know that this information is valuable. It also lets me know that you're here. And above all, it encourages me to do this, because I'm really giving people information that they should be paying money to receive, or doing in-depth research to find this information. But my goal this year is to help as many people open, run, and succeed in their private home care agencies this year. So if you know a friend whose dream is to own a private home care agency, share the link, and you can share it with as many people as possible. Just press right there where it's by my nose, hold it, and then it'll give you an opportunity to share this live with as many people as possible. You might just be helping another person achieve their dream. So let's do it together. Thank you. Now, when we talk about the compliance and regulation issues, we'll talk about how, you can be able to maintain your permit. Because let's say they come to survey you and things are not in order. Your paperwork are not in order. You're not meeting the standards of your state, whatever. In last live, I did share individual states, and I kind of let people know where they go to, what agency handles the compliance or the permit for home care agency in your individual state. For Georgia, is the Department of Community Health, okay? So you want to hire people that know a little bit more than you with handling papers, or you outsource them if you're not able to put someone, because money is another thing. When you're opening a new business, you need money in order to be able to run the business. And as a subscriber, that's another perk that you get. I have done some research over 10 years, and I know some sources that you can get some finances for your business. And that's one of the things people ask me a lot. How do I get money? And you just don't get money like that, but you have to know where to go and the steps to take. And that's one of the things that I give exclusively to my subscribers. So at the bottom of your screen right there, you can go ahead and subscribe to become part of my team and get those in-depth information of how you can get the finances or the funding for your small business. Because in the beginning, it can be challenging. It's rough. I remember in 2015 when I started Kind Touch Healthcare Services, I spent all my money. Like I said, I spent $20,000 paying a consultant to help me get this information that I'm sharing for free here. And after I've gotten the permit, yes, they helped me put the paperwork and submit for the permit as well, which I'm grateful. But I think considering how much I charge people now, that was just ridiculous, right? And so, but that's okay. I made the money back 100 times over. So because I put in some work and God has blessed me as well. So I had such a difficulty when I first started. I didn't know how to put things together. I didn't know how to put the paperwork together, but I didn't know where to get money. So we were talking about money. So hiring people was difficult. And thank God that I'm a nurse. So I did the nursing part by myself. And I did some of the caregiving part by myself because, when you're a new company owner, a new home care agency owner, any new business, you've got to wear different hats. I was the cleaner. I still clean my office now sometimes. I was my HR person. I wore the hat of a community advocate. I wore the hat of the HR coordinator. Now I have all those people. We are in a given month about 50 staff members strong. Now, if you know anything about home care agency, there's some down moments. Some people may not be actively working, but at any time we are constantly at 30-35 employees constantly. So imagine I did all of that. I did everything. And in the office, we have 7 staff members in our office. We have someone who is the HR coordinator. I have a clinical manager. At one point, we had a lot of clinical managers. We're in 16 counties, so we had to have all these people. But in the beginning, it was me, myself, and I. So the question is, how do you get money to run your business? And that's some of the perks that you get when you become a subscriber. It's about $2.99 a month. That's it, to get this information. And you get the templates, you get the strategy, you get the hand holding, all those things that you need in order to move from point A to B to C and to, yay, success. Let me, right? If I have anything to say about it and you're following me and you're a subscriber, you are going to succeed, because I bring the experience that I've gotten in this 10 years. I wanted to tell a story. So in the beginning, I did not have money. After I spent all the money getting the permit, I needed a website, because you have to have a web presence. 10 years ago, it was as important as it is. It's even more important now. So I said to myself, you got to sit down and figure this out. And I had people who didn't believe I could do it. I had people, and that's another thing. Don't discuss your business with too many people. You don't need to tell people. Please tap the screen for me. It will encourage me to keep giving you this information and sharing my story with you. As you come in, just tap your screen. It's a tap, tap, tap. And that will help me, okay? Thank you. And there is a heart right there where it says Dr. B. Go ahead and click that for me. And just send the heart, right? And I will thank you so much. Thank you. I thank you anyway. So anyway, I got myself together, and we didn't have ChatGPT then. Think about that. We didn't have no AI to help. I studied when I would come back from work. I was working as a professor at a nursing school at the time, and I was also working as a nurse at a hospital. So I would come home in the evening, and I was working on my doctorate degree. Don't ask me how I did that. Either I am just a crazy person, or God has just endowed me with some genetic components that I think now I'm getting tired. I don't know which child I have passed that along to, but of my 3 girls right now, somebody's probably taking on that trait. But anyway, I would sit and study how to build a website, and I did. I built my own website because I didn't have money, and it didn't take. It took us 2 years. At 2 years was when I could really, I thought about it because I got so busy. Clients were coming in. I was doing all the right things, thank God, and, making mistakes along the way. That first year was a year of mistakes. I was very blessed to have 2 clients in our first year as soon as we got the permit. I was very, very lucky. My time is coming, winding down. Let's keep talking for a little minute. And so I made huge mistake. I got the kind of client that I could not. It cost me more money keeping that one client. But guess what? Year 2, we had made about $100,000. I was like, what? For some people, that's not big money. But for someone who didn't have that kind of money at the time, that was mind-blowing. That was revenue. We'll talk about that, because when people hear that you make millions, they think all that money went in your pocket. Remember, I had to pay some people too. So year 2, we really broke. We broke even. We went 100% and we made $250,000. So I tell you that to let you know that the business is rewarding financially, it is rewarding emotionally. It's stressful, but it's rewarding. So let's move on. So the next challenge, we've talked about hiring clients for brand new home care agency owners. One of the challenges you have is hiring your caregivers. We talked about the solution to that. And then the next thing that we talked about was the high turnover rate. And we talked about that, how you can make your caregivers part of, make them feel ownership, make them feel valuable. We talked about client retention and satisfaction, and you have to check in with your client. That was one of the solutions that I gave, and train your caregivers on how to be good customer service providers. We talk about compliance. Compliance is a big deal. You want to use a software to manage your documentation. We use a system called Alora. I like Alora. We've used it for a while. At a point, we had left them and tried to use another service that wasn't very useful. And then to us, I mean, I'm sure it's useful to other people, but we came back to Alora and we kind of walked through things with Alora. And so that helps us with documentation, with clocking in and clocking out. It keeps people honest. We can see in real time what our team members are doing. That's a plug for Alora Plus health home care software if they get to see this. But anyway, it's a good system. So find a good system to manage your documentation, because in home care, documentation is everything. If it was not documented, it wasn't done. Hi, Sugar. I wish I could say all of your name. Thank you for stopping by. Please tap the screen for me as you come in. Tap the screen for me. Thank you so much. So the next thing we want to talk about, the next challenges in home care agency ownership is marketing and actually getting the clients. Remember, we just number 3 of the challenges was keeping your clients satisfied and retaining them, retention and satisfaction. But marketing and getting new clients, marketing goes both ways. Marketing to get caregivers, marketing to get clients. It's a big problem. Why is that? Because the market is crowded. It's a crowded market, but you have to brand yourself. You have to be able to stand out. And I teach you more about that in our boot camp. We have one coming up in June. And I also, for those of you that subscribe, that's one of the things that I will be able to teach you, give you templates and direction in how you can market effectively. Because effective marketing and effective branding puts you out there so that people know you and people can want to choose you as their provider. So other than, other people being in the same market with you, you have to be able to know how to stand out. Focus on storytelling. One of the things that got me into home care, aside from the fact that I just love to care for people, I'm a nurse by profession. One of the things was when I had my twin daughters. One of my daughters, my girls are grown now. They're about 20 years old now. But when I had the babies, one of them had a serious respiratory issue and she had some challenges. She was on a ventilator. She fed through an NG tube. So, I feel like God has just called me into the pediatric ministry. That's how I call it. For me, I see my job as a calling. So I thought about how difficult it was for me. My babies, I was caring for twin babies, and I also had a 2-year-old. It was very difficult having a child that had to be in the NICU, and the twin sister had to, in fact, after we were discharged from the hospital about 6 months, we came home. The minute we came home, I noticed that one of the twins was not breathing very well. She was having difficulty, and it hit me. Oh my God. This baby caught RSV. And if you know anything about respiratory syncytial virus, it is highly contagious, especially for preemies, which my babies were a little bit premature. And so we had to immediately separate the babies. Keep in mind, my other daughter just turned 2 years old the day after the twins were born. So it was tough. I had to, run back to the hospital with the other twin, the same twin that was in NICU, who now she caught RSV in NICU. So we went back to the hospital. And for the next month or so, we were just running like chickens. I felt like, I couldn't think well. I hadn't worked for a year, remember? So finances were rough. And so I'm in the hospital with this twin. And before I can leave this twin, switch places and go home to take care of the other twin, I had to run back, take a shower, because I can't just breastfeed her with, coming from the baby that had the RSV. And we went, and I had to find time for my 2-year-old. It was hectic. Sometimes I would just sit in my closet. I remember one day just sitting down in my closet, and I cried, and I said, Lord, I don't really remember asking you for twins. Why are you giving me these babies and I don't have time to enjoy them? I have to see how I can keep them alive. It was difficult, and I was already a nurse then. This was 2003 when the babies were born. And so it hit me. How are other parents handling this? How is a first-time mom or someone without experience as a nurse handling a situation like that? That's how my business was born. That's how Kind Touch Healthcare Services was born. And we started with primarily pediatrics, and we're still at 90% pediatrics, but some of our babies have grown over the years. Some of our kids have aged out of the pediatric program. And so we ended up starting the adult section of our home care agency as well. And we provide services to adults. As you come in, hi, Anthony. Thank you for joining. Please tap the screen for me. I would appreciate the encouragement. Thank you so much. And if this information is beneficial, tap it and share it with someone, okay? And up there, you can also join my team to get more information. You'll see the heart right there above my name, or right next to my name where it says Dr. B. If you would just check in for me, I would appreciate you too. So one of the ways I was talking about, the challenges, my story, and how I got into home care agency 10 years ago. We're celebrating 10 years. We call it 10 years of kindness, 10 years of just loving our clients and loving each other and caring for our people, caring for children and adults. So if you're just getting this permit or you're thinking about owning a home care agency, this information is for you. We've been going through the challenges, because one of the things I don't like is for people to say, yeah, I'm coming into the business because there's money in it, and you don't really know that there are challenges, and you don't know what the challenges are so that you know how to navigate them. I don't want you to come into this business and then within a year you shut your doors. You spend much money, you spend time, your emotions into getting into the business. My job this year is to help many people not just open the business, but succeed in their home care agency business. So the next thing we were talking about, we've talked about 4 challenges, or the 5th one now is marketing and getting new clients. That seemed to be the biggest thing with all my new home care agency owners. And if you subscribe, you will get an actual strategic step on how to get your first 5 clients. You will get strategies, handholding, templates, all of those things from the subscription. So at the corner right there, go ahead and hit subscribe. It's about $2.99, and you get information that I paid $20,000 for. 10 years ago, I kid you not. And then I was broke. You will also get some information about how to access some funding for your small business. That's also part of what I teach, and information I give you, direction, I give you links on where to go and how to prepare your documents in order to be able to get grants or get financing, maybe loans or whatever, in order to operate your business, okay? Because you need money to run a business. But the fun and the good thing about home care agency ownership, the private home care, and I did tell people the difference. So when someone will say, oh no, not that one, thank you for the follow, thank you for the follow, thank you so much. Not a private home care agency is very different from a home health care agency, and we define that before, and I think I have a video on my page that also explains what that is, so that you know. So marketing and getting new clients. First thing is tell your story. Focus on storytelling. People see your heart. People see when you're genuine in any business aside from home care agency. But with this one, because we're talking about home care agency ownership, focus on storytelling. Share real client success or your own personal story. Like I shared about my twin girls and my 2-year-old, the struggles. And that's why pediatric was my thing, right? Because I understood now, before you share a client story, ask for permission, okay? There is such a thing as HIPAA. So you just don't go ahead talking about people and mentioning names without permission, all right? Please tap the screen as you come in. Hi, Anthony. Tap the screen for me. I really, really would appreciate that. Thank you so much. Second thing, you want to build relationship. I made a video that I posted on my page the last time about relationships. It goes a long way in life, in business, in anything that you do. Relationships go a long way. Make and form good relationships with hospitals, rehab centers, senior living communities. If your thing is pediatric, like I am, my calling and my background is in pediatric nursing, and you want to lean on that side, form relationships with case workers at the children's hospital, in the pediatric doctor's office. Build relationships. And we can talk more in depth. I can give you templates and directions and strategies on how to do that once you become a subscriber and join the team. Right over my name, Dr. B, you will see a heart. Please go ahead and check in for me. I will appreciate that so much. And if you are not a home care agency owner, or you are not thinking of owning one, just press onto where my nose is. Hold on to that. You can share it with other people. You never know. You can help someone achieve their dream this year. And that will be a blessing, a very good Easter blessing. Another thing is for you to have a strong online presence. Nowadays, everybody lives online. It can be scary, but it is what it is. So that you go to where people are. When I started Kind Touch Healthcare Services 10 years ago, many people were not online. Hi, Positive Queen. Thank you for stopping by. Please tap the screen as you come in. Tap the screen. I actually have a goal. We have a goal of reaching 20 star roses today, and I've got 12. So I would really appreciate your tabs, your gift, and just the heart. Go ahead and check in for me. Join the team. Subscribe right at the corner to get more information, or just share this information with someone who would and who can benefit from it. Some people just don't know where to go to get information, and you can be that link that shares this with them and help them find their information. So the 5 things we've talked about hiring caregivers. We've talked about high turnover rate. We've talked about, compliance and regulations. We've also talked about marketing and getting new clients. And the final thing that I want to talk about before we go off this air is financial challenges, which I kind of hinted on that before. I said my clients, I give them, real direction on how to get their documents together and where to find funding. Where do you go to find money? A lot of new business owners, new agency owners, especially women, are asking that question. How do I find some money to help me? You invest a little into your business, and in order to continue to grow, you need funding. So part of the perks that you get from becoming a subscriber is that I give you that direction on how to put your documents together, and I link you to where you can apply to find funding, because some people just don't know where to go. Hi, Violin. I love that name. I think it's about playing the violin. My daughter is a good violin player. Thank you for stopping by. Please tap the screen for me as you stop by. Thank you. Hi, Kenpreet. Thank you for stopping by. So as we're about to wind up this live today, one of the things we want to talk about is cash flow. That's the last challenge in owning a home care agency business. Hi, Lady Pam. Thank you for stopping by. Please tap the screen for me as you come in. I really appreciate the encouragement as you tap the screen. So one of the things that home care agency owners, new business owners, come across this financial difficulty. I just told a story about how I had to build my own website from scratch because I used up all my life savings back. Now there is AI to help you. In 2015, I did not have that. I didn't. Hi, Raw 93 times 3. Thank you for coming in. Please tap the screen for me. I appreciate you stopping by. So I had to build my own website by myself. It wasn't until year 2 of my home care agency business that I was able to pay a company that actually built website to come in and do that for me. So how do you solve the cash flow issues? That sometimes you might bill an insurance. It's like the elder care insurance or maybe Medicaid once you become a Medicaid provider. And that's some of the things I help you achieve. You don't get the money for 30 days in some instances. How do you pay your people? Because your workers are not going to wait 30 days to get paid. How do you do it when you only maybe started this business with $5,000? And I promise you, you can start a home care agency with that much money, and I can help you do that. So you offer private pay options to some of your clients. That's something I'm going to teach you if you become one of our subscribers. My team, we help you understand how to bill, how to offer, how much do you bill somebody? What do you do to get private payers? And another thing you can do, you can have a billing specialist, or you can outsource billing so that you don't have the delay. Oh, I tell you, our first year, it was rough. I just told people how I made a negative 40,000. If you want to ask me how, I can talk all day about that. How not to make negative 40,000 your first year. Year 2, we made about 100,000. The very next year, which was our full first year after year 1. And then by the second year, I would call that my full 2 years. We broke even. We broke through the waters and up the sky, and we made $250,000. Ever since then for now, I tell you, we make millions and over. Okay, every year. So it is a business that is doable. So you can also. You want to pay attention to your finances. You cannot be a business owner and just let other people manage your money for you. You cannot mix your business money with your personal money. That's where you get into trouble. And when you go to borrow money from the banks or from other sources, they pay attention to how you manage your own finances, believe it or not. And that's one of the things that you will get as part of my subscribers, as part of my inner team. I'll teach you how to put those finances together, how to put your money pocket together so that somebody else would like to give you money. So those are some of the 6 things that I wanted to touch on today. First thing we talked about for new home care agency owners or those coming in who want to own one. We talked about the difficulty in hiring caregivers and how to overcome that. We've talked about high turnover rate and how to overcome that. We've talked about client retention and satisfaction and how to overcome that. Hi, Mtinta. I hope I said that right. Thank you for stopping by. We've talked about client retention and satisfaction. Please tap that screen for me. I will appreciate that so much. We've talked about compliance and regulation, which is heavy in this industry. And we've talked about marketing, getting new clients, and how to overcome that. I've been touching on the problems and solutions. Thank you for the tap. I appreciate that so much. Thank you. We've also talked about financial challenges, and I've given you some information about how to access cash flow. How to access cash flow by offering private pay options whenever possible. Because sometimes when you bill insurance, it takes 30 days for them to pay you. But you've got to pay your people this, whether you pay bi-weekly or weekly. How do you make that happen when you don't come into this business with a bunch of money? So when you become a subscriber, you get information, real personalized information, how to put your documents together and where to go to ask for funding, how you can get those funding. All right. So we've been doing this for about an hour. I think I've gone over an hour, which was what I wanted. I just wanted to be here for an hour, but I wanted to make sure everyone got the right information. Thank you for stopping by. Hi, Grace. Thank you. Please tap that screen for me as you come in. As we are about to round up, somebody would say, with all these challenges, is it still good for me to own an agency? Absolutely. At the end of the day, running a private home care agency is not easy, but with the right strategies, it is 100% possible for you to thrive. If you found this helpful, I am asking you to please tap the screen for me. Share this live with as many people as possible. You never know, you could be helping someone make their dream come true today. And then follow me for more real talk about growing a successful healthcare business. And hey, if you have a question or questions about your agency, or you're dealing with any of these issues that we've talked about right today, drop them in the chat. Let's talk about it, or DM me, send me a message, okay? And we will talk about it and figure out ways for you to overcome those challenges, all right? I appreciate you guys. Thank you so much for stopping by today. And please click the link and follow and subscribe, and share with someone who may be thinking about opening an agency, or someone who just got their permit and they're totally lost. And I am so grateful to you both. Thank you. Thank you for stopping by today. And I appreciate it. For those that stopped, happy Easter, everyone. I am a believer in Jesus Christ. And if you are too, this is the season to remember the sacrifice. That is the biggest sacrifice of all. Was Jesus coming upon the cross. He came, he died, and he resurrected. So tomorrow we celebrate Resurrection Day, because he did not stay dead. Hallelujah to that. Have a beautiful Resurrection Day tomorrow, and the eve of resurrection. We are not sorrowful, we are joyful, because Jesus is alive. Have a blessed day. God bless you. Love you. Thank you so very much.